Health insurance for petrol station workers has become a pressing demand from employees across Nigeria's downstream petroleum sector. The concerned petrol station workers are calling on the Independent Petroleum Marketers Associations of Nigeria, or IPMAN, to provide health insurance for all employees, including pump attendants, cleaners, security personnel, and managers. This appeal comes shortly after the Nigerian National Petroleum Company Limited (NNPCL) launched a health insurance scheme for its retail outlet workers nationwide, a move Labour advocates have described as timely and commendable.
The challenge for us as Nigerians is always that we are so individualistic, increasingly individualistic. Because if you look at the structure of this and you make it a communal thing, let's say there's a market A, or a petrol station in an area like Jabi in Abuja, and you say in this area there's a pot of contribution that has to be made. It is from that pot of contribution that the government contributes to, and everybody has an individual account. What you start to see is the challenges of our own character come out, because people start to think about their own entitlement rather than the collective system and how that system works.
We had the issues with Dangote workers last year, this year that just ended. And the basic issue we have with at that time is the fact that some workers, a lot of the workers actually, are casual workers. And they began to demand that their employment should be formalized, which is the normal thing actually. These are specialists. These are people who should not even be, nobody should even talk about being casual workers there. And how it was resolved eventually, I'm twisting, that's where I saw it. I'm twisting the workers to eventually got to what appeared to be an agreement.
Workers in the petroleum sector face daily risks, including exposure to toxic fuel fumes, fire hazards, and long working hours. Advocates say that access to health care is not a luxury, but an essential protection for those on the front lines of the industry. Rising medical costs and modest wages make petrol station employees particularly vulnerable. Even a single illness can wipe out a worker's earnings, highlighting the urgent need for insurance coverage.
Thinking about what are the consequences of people down the ladder. So I think there's a calling on all of us to help government to think about solutions. Both in terms of how the informal system works and people in the informal system are looked after. So things like healthcare is designed in such a way that they contribute something to it. In the same way we're doing with some of the pension system that's been developed for wider use in the public sector. So it's that kind of thinking, that kind of communal care, that kind of extensive thing, and incorporating the informal system into the formal system that can work.
With occupational hazard ever present, advocates say extended health insurance is not just a benefit but a necessity to safeguard the lives and well-being of petrol station employees. Sydney Okafo.